Thanks, Devin. And today we are joined by Nurse Christina for this week's edition of Nursing the North. Thank you for coming in.
Yeah.
How are you?
Oh, good. Always glad to be here.
Oh, so we're so glad to have you.
Thank you.
Well, and according to the Arthritis Foundation, arthritis affects more than 50 million adults and 300,000 children in America. So can you tell us a little bit more about the two common types of arthritis there are?
Yeah, absolutely. So there's like a dozen different types, but arthritis basically is just wearing down and pain in our joints that we get. So one of the most common is osteoarthritis, and that's just wearing down of the joint. So on top of, where two bones meet, we have cartilage, and through overuse and stuff, that cartilage can wear down and causes discomfort. Usually with osteoarthritis, it will be the weight-bearing joints, like your hip or your knees, and can sometimes affect shoulders, things like that. And so you're gonna have a lot of pain and stiffness. You might just also have like crackling sounds that you'll hear in your joints.
Kind of like the trees outside with all the ice.
Exactly right now. Yep, absolutely. And sometimes even some extra bone growth can occur.
Oh, interesting.
Yep. Mm-hmm.
Well, is there anything that can be done to kind of help reduce the damage caused by arthritis?
Yeah, absolutely. So with osteoarthritis, some of the things you want to do is you can, of course, resting your joints is helpful. You can try like weight loss. That can also be really effective. Get plenty of physical activity. So keeping your muscles stronger will help. Using assisted devices. So maybe if you do have really bad arthritis in your hips, maybe using a cane to just kind of offset some of that pressure. And the use of hot and cold packs can also be really helpful.
Awesome. And then what kind of like professional help options are there?
Yeah, so for osteoarthritis, it's mainly just going to be pain relief. So using like ibuprofen and Tylenol, and then the lifestyle changes.
Gotcha. Mm-hmm. And then there's another common type of arthritis, which is rheumatoid. I'm pronouncing that correctly.
You are correct. Yep.
What is the main difference between those two types of arthritis?
Right, so rheumatoid arthritis is a autoimmune disorder. So that means your body is kind of fighting against itself. So it's causing a lot of discomfort. It's also more systemic, where osteoarthritis is going to be right in your joints. Rheumatoid arthritis, you're going to have symptoms all over. And so it's more of a systemic. So you're going to feel muscle aches. You might feel like even just overall fatigue. Even depression can happen, especially, whenever we're talking about chronic pain. It wears you down emotionally as well as physically. You might have fever, and you will have some joint swelling in that area. Also, rheumatoid arthritis tends to go to the little joints, like in our fingers and hands or wrists, things like that. That's where we're going to see it. And with rheumatoid arthritis, you're also going to have a a symmetrical. So it will be in both hands,
Okay.
or both toes or feet or ankles or wrists, where osteo will just be in one.
Gotcha. And what are some of, how can this one be treated versus the osteoarthritis?
Right. So with this one, we're going to use disease modifying anti-rheumatoid, anti-rheumatic.
Lots of words chained together.
Yes, right, medications. So like you might use something like a steroid because it's your body fighting against itself. So steroids will help bring down that inflammation. There's a lot of other medications that doctors can use as well. They're going to test this one. So rheumatoid arthritis, there is a blood test that you can test for specifically, and there's rheumatologists that just work on that specific type of arthritis. But physical therapy, occupational therapy, seeing a dietitian to help with weight loss, cardiology, because sometimes it can affect your heart as well. And then just, getting a lot of support. So things you want to do on your own, would be going to support groups or reaching out to other people who are affected by by this, and kind of, I'm sure there's Facebook groups, you know,
Sure.
all of those social media platforms have them. Staying active, again, eating healthy. You want to quit smoking. Tobacco can interfere with calcium absorption in your
Okay.
bones. Well, not tobacco, but nicotine. So
Sure.
you want to be, you know, if you can quit smoking, that's of course very helpful. Go to your doctor's appointments using ice, heat, cold packs, things like that.
Awesome. Well, is there anything else that our viewers should know about these types of arthritises?
You know, if you think or suspect that you're starting to develop arthritis, definitely go in and talk to your doctor. And again, they can do some tests, they can get you into some kind of therapies and just help ease these symptoms. Sadly, so many people really suffer with chronic pain due to this. So, you know, doing different things you can do, especially when you're young, to help avoid those, especially the osteoarthritis with the wear and tear,
Sure.
is good.
Sure.
Helping in the long run. You
Right,
know,
so
start
just-
early, help long.
Right, so just keeping an eye on, you know, pain in the joints, making
Right.
sure you're staying active, making sure you're going to the doctor.
Yes.
Huge thing.
Yes,
Well, all right,
absolutely.
well, that is all the time we have, but
Yeah.
thank you so much for joining us, and thank you for very informational. I learned something, that's for sure.
But glad to be
And
here.
we'll have your What's Trending after the break.